How do you make a torso look better? A traditional tummy tuck or abdominoplasty is known by most, but what I want to talk to you about is what I call a tunneled mini tummy tuck with umbilical float. So I have a lot of unique artistry in torso rejuvenation in patients as I do a lot of mommy makeovers. Once you've had babies, you end up with stretched out skin, sometimes a bulge in your musculature of your abdomen, many times stretch marks. There's many ways to address this. Unfortunately, many surgeons only approach it with the traditional tummy tuck. A tunneled mini tummy tuck with umbilical float is perfect for candidates who have minimal extra skin laxity. However, their main concern is that abdominal bulge that happens with post-pregnancy changes. And that's called a diastasis recti. So if a patient has that bulge they notice after a large meal, big bowl of soup, sometimes when their hormones have changed, they notice that little bulge and that doesn't go away very easily, but they don't have a lot of extra skin that would mean that they would need a traditional tummy tuck. So in that case, what I do is I make an incision that's smaller than the traditional tummy tuck incision below the underwear and bikini line. I dissect up and release the belly button underneath the skin, so there's no cut on the umbilicus or the belly button at the skin level. I then dissect all the way up to where the top of the muscle layer is in the abdominal wall and repair it all the way down. And what that does is it completely removes that bulge that patients may have. I then remove a small sliver of skin down by the incision line, and the belly button gets tacked back down right where it belonged. So it's essentially a muscle repair with some removal of a little bit of the laxity that exists below the belly button for women. It's a wonderful procedure and a great technique to have for patients who are very fit, who really their main concern is that abdominal bulge.